Suppose your dentist have done this x-ray and the dentist have given it to you and told you that you have a cavity. Now how will you note that where is my cavity? I'm not having pain, I'm not having sensitivity. Why the dentist want to restore it? Why the dentist want to fill it up? Because you're not able to see anything. This looks like a perfect tooth, right? So for that reason, you must know how does a cavity looks like in an x-ray. Okay. This is a tooth lining. Okay, a break in a tooth lining, a black spot, that is your cavity. Okay, now similarly, if you look over this tooth, the break in the tooth line, that is your cavity. Okay, a cavity meaning an empty space in the tooth. The microorganisms have eaten that tooth structure, and that is why it has created an empty space inside the tooth. So whenever we do a x-ray, so x-ray beam get cross over those empty spaces, and that's why it turns out to be black. Tooth absorbs the x-ray, and that's why it turns out to be white. Okay, now this is your empty space, this is your empty space, and that's why it turns out to be black. Now that black spot is your cavity. Now do not get confused by these black triangles. Okay, now these black triangles, as I told you in my previous video, these are interdental spaces, meaning in between your two teeth. Okay, now these are natural spaces, empty spaces, and that's why the x-ray beam has just crossed it, and that's why it has turned black. Now the same concept is of the cavity. Okay, now these empty spaces are the natural spaces, these are not cavity. The cavity is seen on the tooth lining. So here the cavity, if you look over the tooth lining, the cavity has reached to the enamel. It hasn't reached to the dentine yet. Okay, similarly on this tooth as well, the cavity has crossed the enamel part and it is reaching towards your dentine. Okay, now I'll show you how a cavity progresses from a very small hidden cavity to a big cavity. Okay, let's see. Did you notice? So earlier it was this small. The patient did not get it restored. Now it is still in enamel. Okay, the patient did not get it restored. The cavity extended in the dentine. Again, the patient did not get it restored. The cavity extended further into the dentine and more close to the nerve. This is your nerve. The patient did not get it restored. So again, the cavity increased. Now it is clearly very, very close to the nerve. Look. Okay, the patient again did not got it restored, and by this time patient must be having pain, sensitivity, or maybe a food lodgement complaint. Okay, now again the patient did not restore it, so the cavity further extended and now it is on the nerve. Okay, now at this point you will need a root canal treatment if you have a pain, you have a swelling. Okay, so it is always advisable to get your x-rays so that you can at least see the cavity in your tooth. As the cavity moves further, the cost of the treatment also moves further. It becomes more expensive if you ignore it at every phase of the cavity. See, this is a clear tooth. You cannot see any break in the line of the tooth. Okay, here if you will look, there's a break in the. Now how will you know that whether I need a root canal, whether I need a filling over it? What do I do? So always remember, this is your nerve, this is your nerve. Now that black spot is on the nerve. Okay, so there is a chances of a root canal in these cases. Okay, now I think you will be able to recognize the cavity. Can you? If not, then I'll tell you again. These are those spots. These are very initial cavities. Get it restored at this moment only. Don't wait for it to progress further. Okay, because of third molar, the food was getting lodged inside and it started having cavity. Now you will say it looks like exactly this point. How do you identify? See, now this space is inside the tooth, so that means it's a cavity. Okay, as simple as that. And get such x-rays in every 6 to 8 months. If you feel that you have a lot of carious activity in your mouth, get such x-rays. These are bite wing x-rays. Okay, they take at least 1, 2, 3, 4, 5, 6, 7, 8 teeth in an x-ray, or minimum to minimum 6 teeth in an x-ray. So that shows these hidden cavities. These hidden cavities are very dangerous cavities because you won't get to know, and these cavity extends further. Okay, and you will get to know by when the cavity has already reached to your dentine, and you will have a complaint of food lodgement. You will complain that my food is getting stuck and I'm not able to eat from this side because whenever I eat, the food starts getting inside. Okay, so this is a very common complaint of patient who are having such cavities. Okay, this was a pretty overview of how a cavity looks like in an x-ray, what you should do to avoid have a cavity, and that's it. Now, how do you identify that you have done your fillings? Now, how do you identify the filling is done by the dentist? Now, the filling usually looks like super white. Okay, when a dentist do your x-ray after your filling looks like super white. Now, this shows that the filling is done. This is your super white filling. So, this shows that this tooth is filled up. So, yes, this is how your filling looks like in an x-ray. This one. This is how your cavity looks like in an x-ray. Okay. This is how your tooth structure looks like in an x-ray. If you have an acute carious activity in your mouth, get x-rays in every 6 to 8 months. If you do not have that a lot of caries activity in your mouth, then continue with the oral hygiene habits, but get x-rays of your back teeth at least in a year. Very important to diagnose these small cavities. Thank you so much for watching.